Let's get started. Hi, everybody. I am Dr. Kimberly Thornton. I'm one of the reproductive endocrinologists at RMA. See, some of my patients have joined, so you guys know me. The others I don't know. Nice to meet you. And then we're here with Rina. You want to introduce yourself?
Hi everyone, I'm Rina Gower and I am the social worker at RMA. So nice to meet you all via Zoom.
Yes, and Rena is a great resource we have at RMA of New York. She's free for all of our patients. And she really, I mean, your specialty really is infertility support. Like you do counseling and support and all of those things, which are, great resources. And I guess to get started, I think this is really important topic for both of us. Rena, feel free to chime in anytime. But stress and infertility is like very, very prevalent. All even like literature and data supports it. So if you want to like look hardcore at the science, most studies have shown that one of the biggest reasons patients drop out of treatment, even those who have insurance coverage, those who have good prognosis, who would likely go on to be successful, is actually due to the emotional burden of care. It's one of the major top reasons for stopping treatment. And I would say, as a doctor in this field and doing this for a while, I do see people emotionally burn out, and I think studies show the stress level is as high as like patients going through treatment for cancer, heart disease, or really major medical issues. And so if you think about that, it's nothing to take lightly. And so I think people don't sometimes talk about it enough, about how stressful this process is and how that they're feeling. And so I think it's just really important to talk about truths, myths, support options that are available, because mental health being and reducing stress levels is really, I think, important for everyone's overall journey and experience, because this is, no one ever wants to walk through, a fertility office and find themselves there in the first place to try to make it as smooth as can, potentially be. And then I think I talked about this when they had me do that 2-minute Instagram live. Depression and stress are very prevalent. One of the biggest studies we have in the United States came out of Northern California, and they looked at patients from over 5 different centers, and it was over 3,500 patients. And the stress or the rates of self-reported depression for women going through fertility treatment was 56%. So that's more than half. And they even looked at partners, and it was 32% of men reported feeling depression. And stress was even higher. Stress was 76% of women and 61% of men. And so, this is something really real. So I kind of wanted to, bring it over to you a little bit, Rena. I guess to start out with, I know a lot of people always want to know, how did you, get interested in this? How did this kind of become your area of expertise? And start off at that point.
Sure. So I think that was a really wonderful intro, and I love how you shared data and stats with everyone to show this stuff is real. One of the first things I say to people is the stress levels of infertility are the same as AIDS, cancer, and heart disease, and those are really high. And so you asked how I got into this. So I was a patient myself. I wasn't an RMA. I was at a different clinic. But I, found the process so incredibly difficult, and it totally changed I was, already a social worker, but I didn't specialize in this field. And when I got out of, what I always say was sort of some of the darkest, it was about a 2-year journey for me of my life, I realized, wow, no one should have to go through this. And so I got into this field, and now, I have specialized in this with specific training and everything. And I think, I'm pretty open about it, because I think with my patients, I find that it resonates with them. I often say this is sort of the club or sisterhood that nobody wants to belong to, but we do. And I think to find that you're not alone is really, really helpful. I think something I see a lot with patients and with myself is people think they can take this on and continue to live their life normally. Let's just add fertility treatments to, our already crazy New York lives and just keep going about our business. And people find a problem and they realize that's really hard to do. And then that's when sort of anxiety and stress can kick in. And so something I talk a lot with my patients about is, a couple of things. One is that's just not possible, and if you were to look at someone who is undergoing chemotherapy, which sort of as a society is kind of more broadly understood as like, okay, that's really stressful. We wouldn't expect someone to do that, going through that, to be able to maintain their normal life. That's a big stressor. It's a lot. And so we would understand. Unfortunately, infertility is still kind of quiet. People don't understand as much about it, which we want to change. So that when people understand, okay, you're going through fertility treatments, they get, well, okay, I can't operate how I used to operate because now I'm adding this big stress into my life. And so something I work with my patients a lot on is how do we make going through the journey of fertility a part of our lives and not the whole. So that's sort of a long response to your question.
Yeah, no, and that I think is really well put. And I really love how you compare it to chemotherapy because I think most people, so many people that I know going through infertility treatment don't want people to know, or sometimes don't even tell family or friends or work, or because it's very personal. And so, but when you think about it, other major, disorders, most of the time people or things know, and so you kind of allow themselves to take those time and self, and by infertility a lot of times people don't, and that's very, very difficult.
Yeah, and I think one of the studies that you and I discussed before this was that research shows most people don't share this journey, and so that's something I certainly see in my population. And so I always encourage patients, a really important piece of this puzzle is to build out your supports. So is that joining support groups? Is it joining a couple of other resources that I share with people, how to kind of connect with other people in the space? Is it figuring out how to communicate this to your friends and family, which is really difficult? But research really does show that letting other people kind of hold your feelings, as the saying goes, is really important to helping to navigate this and to not feeling so alone and that you have to take all of this on by yourself. But I think, just as how cancer, 20 years ago was still like the C word, infertility is kind of still in that space. And we, as I sort of said at the beginning, we haven't yet progressed to where, people understand about infertility and how difficult it is. And one of the kind of bigger things I work on, and I think, you're working on too, much of us in this space are working to change that stigma so that there is a broader understanding. There is more understanding of how stressful this is, both among family, friends, workplaces, et cetera, so that people don't feel that they're bearing this burden, so alone.
Yeah, and the statistics are 1 in 8 couples struggle to either conceive or to continue with a pregnancy or have recurrent miscarriages. So 1 in 8 people, that's really high. And people tell me all the time, I don't know anybody else going through this. I feel so alone. And reality is they probably do know somebody going through it. It's just women are very personal, and a lot of people keep this to themselves. And some people are open books and talk about it, but it's a lot of people don't. And so sometimes, people feel more alone, and that this is more rare than it actually is.
Sure. And I think that goes for, kind of all aspects of this space, be it, going through fertility treatment or miscarriage or loss. I think kind of the gamut, people often don't share. And then when they do, they're like, oh my gosh, I just met, multiple people who kind of came out of the woodwork to share their story with me. And it's really, really therapeutic.
Yeah, and I just wanted to read, because we got a comment about it also stands for people who don't necessarily have fertility issues, because yes, there are some reasons other people go through IVF, like carriers for genetic disorders that you want to test, embryos, or even even LGBTQ. Sometimes it doesn't always go like as smoothly as we think for same-sex couples, whether male couple, female couple. the whole process, sometimes what we think is gonna, okay, this should be easy, sometimes life throws curveballs. And so, yeah, I 100% agree with that comment. Just going through this process is hard, and it doesn't matter if, if it was that 12 months of unprotected, that like quote unquote infertility diagnosis leading to there, or 6 months depending on age, or if it was something else in life that led you to starting treatment. That you're 100% correct. It's really that stress is there at all aspects.
Right. I think that's a great comment and point, and it's really um, anyway across the board. I think a lot of it kind of goes back to biology too, and we all sort of have this biological innate what we feel is our right to reproduce, and that's almost biblical. It goes back to Adam and Eve. It's just sort of humans feel like it's our right to reproduce, and whether or not we grow up and we choose to not have children, that's our right. But when people need treatment to do it, it's almost stripping us of this biological right. And that could be because of genetic testing, or single parenting, or you're in an LGBTQ couple. But the second you set foot in a doctor's office to conceive, that kind of goes against our biology, and so it's really, really difficult to reconcile and sort of reframe your thinking to, okay, whatever your fantasy was about conceiving. And a lot of people feel like they lose the element of surprise from either peeing on a stick to doing a gender reveal, that's all taken from them the second they walk through the door. It's really, really difficult, and so something I work with a lot with patients on is, how do we kind of regain control of that? How do you get back the element of surprise? Like, yes, a lot of things are taken from you, and there's a lot of what's called intangible loss when going through this process, but how do we get that back? How do we take control of the situation? And so I help people to kind of reframe their thoughts around this, to feel in control, feel like they're still kind of walking an individual journey, and that they have control of their fertility.
Yeah. So a lot of times, I actually mention you to a lot of people, and a lot of times people look at me like I don't want to speak to somebody, or sometimes people are just like nervous to make that step. Just to like make it not seem as scary. What is a normal like first, like encounter with a patient like, so people kind of know what that journey or path is, to make it not seem as intimidating?
Sure. So my training and my personal philosophy is, so I meet somebody where they're at. So that's wherever you are, like that's where I go. And I think I'm friendly and open, and there's no right or wrong way to have a talk. Is it, a patient comes to me and they just want resources for support groups, they just want someone to kind of give them a boost, that's great. Is it they want someone to kind of do ongoing therapy to help them through the process? I really kind of wear a lot of different hats, and again, meet somebody where they're at and where they're coming to when they come see me. And so what I do when someone is connected with me, the first step, picking up the phone or reaching out is the hardest. And so I think that's already so strong. And then we just talk. And I always say, look, I reviewed your chart, but I like to hear from you in your words. What has this journey been like? What has the process been like? And then we just have a discussion. And, at the end, I'll give an assessment and recommendations and talk about goals and objectives. And, my own personal goal as a practitioner is to always leave somebody with feeling like they have more tools than they came in with, more coping mechanisms and supports, and also too just another person kind of on their side to help them get through this, who really understands. So that's kind of where I come in.
And then one of the other things that I think is the worst thing anybody can say to people going through this fertility journey is when well-meaning like family and friends are like, okay, just relax and it's going to happen. Like, what do you think about that? I mean, we can go into what I think about that, and how to deal with that, because I think people don't mean to be hurtful when they say that, but it is very hurtful.
Sure. So I always say, look, I mean, human nature, when we see someone that we love or care about is hurting, we want to fix it. So the reality is nobody can fix this situation for you, because what you really want is a healthy live birth, and no one is going to be able to give that to you. So they say things that they think is going to get you there. And things like just relax, or why don't you just adopt, or stop drinking coffee, or whatever they think is going to be helpful. And it's not coming from a bad place. It's coming from a place that they're trying to help. And, again, what you want, they can't give you. And so I always say, it's hard because it's another thing you have to do, but you have to learn how to communicate with people and let them know what you need. Do you need them to check on you every day? Do you need them not to talk to you about this? Do you need them to give you a hug? Do you need, like, whatever it is? And also to understand, like, what you need this week might not be what you need next week. But it's really important to check in with yourself first, to say, okay, what do I need from my friend, my family member, my partner, and then communicate to them. And so, again, it can be frustrating because it's like, oh, another thing I have to do. But I think you really have to set people up for success in this. And I think, again, try and remember, people want to help and they're just not sure how. And so you have to kind of give them the tools.
Yeah, and then I think one of the things I really love that you always talk about is, people are always like, is it the chicken or the egg? Am I not getting pregnant because I'm stressed, or am I stressed because I'm, having trouble getting pregnant? And I think that pretty much all the data and literature and like what we can say supports it's actually infertility causes stress. Stress does not cause infertility.
Exactly.
And stress is not good. It can lead to, riskier behaviors. It can lead to more drinking, smoking. It can just mentally put you in a not good place. So I don't think any of us by any means are saying it doesn't matter your stress. This doesn't like play any factor or role because it's not healthy. But at the same time, people have gotten pregnant through depressions and wars. They've even done one of the biggest meta-analysis for IVF patients. A meta-analysis is, like, I like to say, a fancy term where they looked at a bunch of studies. So they looked at 14 different studies. So it pulls thousands and thousands of patients together and they get an overall conclusion from it. And it actually, patients who reported high level of stress when they were beginning IVF versus patients who didn't, they actually, both groups have the same outcome. So it actually doesn't seem to affect your overall outcome of success, but it's affecting obviously your personal mental journey in other, really unintangible ways. And so I also think, what you kind of talk about a lot, and you probably can say it better, is like saying that your stress is what made you infertile is almost like a way for people to self-blame. Like, this is something that I did to myself, which is not healthy. Or if other people are saying, relax, your stress is causing this, it's a way of saying it's almost like something done that you are doing to yourself, which is definitely not true. People wouldn't say, well, you gave yourself cancer, any other disorder. So I don't know if you have any thoughts you want to add on that.
Sure. Yeah. I mean, I think you said everything, so accurately. We kind of say stress doesn't cause infertility, but infertility causes stress. And sure, look, people get pregnant in all sorts of, horrific conditions. So there really is no kind of hard evidence to say that your stress is making you not get pregnant. So when a patient comes to me and says, oh, I'm so stressed and I'm worried that's affecting my cycle, I say, okay, it's not affecting your cycle, but it's affecting you. And so my goal is to help you have a better quality of life. And that kind of goes back to, how do we make this be a piece of your life and not the whole? Because I don't want you to go through each day feeling so anxious and upset and cycling through, difficult feelings. I want to help you be able to manage your stress and anxiety so that you're able to acknowledge your feelings and validate them, but then also be able to enjoy your life. And, I think a lot that's difficult with this process is people feeling like their life is on hold, because there can be so many stops and starts with this. It usually takes longer than people kind of expect. And so how are you able to kind of manage all of that and continue to feel like you're moving forward and not like you're moving 20 steps back?
And then one question I have for you is, like, what other support resources are available? Like, I get this question asked all the time. Like, of course, for our patients, you're always, available to meet with them if somebody is interested in that. Some people are like, I'm not ready for that step. Are there other resources that, are available?
Sure. There's plenty. So I have a couple of colleagues who run support groups, and we can probably find a way, I'm sure we can find a way to post all of this after the conference, but I have a couple of colleagues that run some support groups, and they're specialized, so be it for male factor or donor or kind of just the umbrella trying to conceive. So I have that. Resolve is a great resource. They run peer-led support groups, and now everything is done via Zoom. There's a great resource called Fruitful Fertility, and they are a mentorship program, and they will match you up with someone who's already gone through this, who can be like a mentor to you and another support. And so they're really wonderful. I've sent a lot of patients to them, and they all tell me they've made really incredible matches that way. There's some religious groups who do phone support groups. There really is a lot of kind of different avenues to go. There's some great podcasts out there. And so normally I'll email patients with sort of the list of everything so they can kind of go through. And so I'm sure we can post that.
Yeah, that'd be great resources. And then actually somebody asked, how do we set up an appointment with you? It's pretty easy. Like, I usually have patients, I'm talking about it or they're interested, I usually just shoot you an email and then you usually follow up with them. So really, but anybody really at RMA could get you set up with an appointment, like a nurse, patient, you can tell your nurse, your coordinator, your doctor. I think that they could probably just call the front desk.
You can call or just tell your coordinator you want to, and they'll email me your name, and then I'll reach out to you. Or you can just email me yourself. It's I'm sure we can share that too. But it's pretty easy. And then someone also said that this is like online dating. It's a natural way to achieve something that we feel should be done organically. And yeah, that's definitely it. And I think a lot of times, I'll have patients who are struggling with the fact that they're using, injections and, medical intervention to get pregnant. And it does feel, unnatural. And, I think it's really important to acknowledge that and not pretend that, oh, this is normal, because again, it's not, I don't think most people, maybe some if they're, in sort of, depending on kind of their life, but most people don't kind of grow up thinking they're going to, go to a doctor's office to get pregnant. So there is a lot of merit, and it's important to acknowledge that and say, like, yeah, this is hard. This isn't what I expected. And, I always say, whether it's, you're taking, Clomid or you're on your 5th round of IVF, it doesn't, one is not greater than the other. The fact that you're in a doctor's office to help you with this process is scary. And so it is important to acknowledge that, for sure.
And I think, I've heard a lot of people with everything happening with, COVID, obviously we're getting much better. I had a lot of patients telling me, well, yes, I'm like really overwhelmed, but at least I'm not in the hospital, like trying to justify like, okay, because there's all these horrible things happening in the world. But I think, yes, we're not that situation, but it's also, important to validate your feelings and that it is okay to, feel disappointed and that, stress that you're in this process. And, a lot of people, I think, try to be strong and say, okay, well, I shouldn't feel bad or I shouldn't be upset because, things could be worse. And I think it's okay to this, you didn't, think you were signing up for this from the beginning. And so I think it's okay to feel those feelings.
Sure. I think with anything in life, and certainly in this process, or even sort of now more generally with COVID, I have a lot of patients who say, well, I shouldn't feel bad because I'm healthy, or I shouldn't feel bad because I still have a job and I know I'm better off than, all these other people. And that's not, there's always going to be someone who's better off or worse off than you, right? But the reality is we're all in our own situation. And so how you feel is how you feel. And so it's important, to validate that, and say, like, yeah, there's no right or wrong way to feel stress. It's not, you don't have to try and feel extra grateful because you think there are people who are quote unquote worse off than you. Your situation is yours, and you're feeling stressed. Okay, so let's meet you where you're at and let's work through that.
And then I think we got another question, which I actually think is a really good question. It was actually going to be close to what I was going to ask you next, but it says, how do you deal with envy when someone gets pregnant?
Sure, that's a really good question and something that comes up a lot. Actually, I would say, well, so two things. So we do have a podcast at RMA called Fertility Forward, and one of our episodes, we specifically talk about this. So that would probably be of interest to you. It's called Jealousy versus Envy. We can probably post that too. I'm not sure the episode number, but we do a podcast that talks all about that.
And the
But
link to the podcast is on the RMA website.
okay, yeah.
Yeah, I've seen that.
So we talk all about that. And I think what I always tell patients is it's really possible, to feel two different emotions. So you can feel happy for someone, but sad for yourself. And so I think as humans, we often sort of struggle with this id versus ego thing. How do I deal with juxtaposing emotions? How can I be happy for my friend, but also really sad and angry for myself? And people often struggle with feeling guilty that they, feel that when their friend or family member gets pregnant, whatever. But it's very possible to feel both. You can feel happy for your friend, but also really, really sad about your journey. And so I think it's sort of this balance of, again, validating your feelings and feeling that for yourself, and then figuring out, again, pre-COVID, I would have patients say, well, I just don't think I can go to my best friend's baby shower, or I can't go to the hospital to visit their new baby. What should I do? So we'd come up with kind of alternative methods and alternative things to do that felt safe for them, so that they still felt like they were acknowledging, the birth or whatever it was, but in a safe way. Is it they sent a meal to the hospital instead of going in person? Is it they went for the first 20, 30 minutes of a baby shower, or the last, so they didn't have to be there for the whole thing? And again, it's realizing too, it is okay to modify your life, because you are going through this. And it's a fine line between sort of social isolation and also protecting yourself and taking care of yourself. And so that's something I work with a lot with on people too, to find that balance. And also along that line too, it's always working with people to communicate, and to share whatever they're comfortable with, that friend or family member. Look, this is how I'm feeling, et cetera, et cetera. And to find, what feels safe for you.
And then one question I was going to ask is, do you have advice? Because I would say one of the hardest things as a physician is having to make those calls when, especially especially post embryo transfer, really any time when there's a negative pregnancy test, or especially if it happens more than one time, like any advice on coping with that?
Sure. So what I would do with patients is I always have them come up with a plan. So if someone's in the 2-week wait, there's certain coping mechanisms I strategize with them to get them through that time. And then before they get their results, I have them come up with a plan. So, okay, option A would be you get the call and it's positive. Okay, let's walk through what that looks like. And usually that's like, okay, they'll celebrate, and then kind of one day at a time, they'll, continue with the blood work and the monitoring. So we know kind of what that looks like. Then the second is, okay, it's not what you want to hear. So the first thing I do is remind patients that nothing is ever a waste or in this process. So everything is always a data that you as a physician would use to put towards the patient's journey. So everything is always a piece of the puzzle. So whether it's, okay, I realize, we'll change the protocol, or, we need to do this or that, nothing is ever a loss. It really is always leading you to the next steps. But if it's not what you want to hear, okay, what is your plan? Is it, I'm going to move right into another retrieval? Is it, I'm going to move right into another transfer? Is it, I'm going to take a week to mourn and then I'll figure it out? Is it, I'm going to take a day to mourn and then I'll figure out? Like, whatever that plan is, it doesn't have to be concrete next steps. It just has to be something so you know what's going to happen, because that's going to help you feel in control and like what's coming next. And so there's not so much uncertainty in front of you. And then, of course, it is also to say, like, yes, you need to mourn the loss. You need to feel all those feelings, but you'll have in your back pocket your plan. So instead of feeling, hopeless and like you don't know where to go and like your journey's over, okay, well, I've set this up, so now I know what's happening and I already put everything in place. So that's something I always work with patients on too, to have sort of done ahead of time.
And I think you kind of talked about a lot of these things. I was going to say what type of feelings are common with patients was something I kind of wrote for you. I think you kind of touched on a lot of that. One thing that I think that you've taught me that I guess we haven't talked about is kind of a lot of that I think stress from fertility treatment is a lot of loss of control because it's a lot of factors. And I know that that's actually just talking to you has been really helpful for me, just for some people seeing what's going to help make this process a little bit better. Can you talk about like what you think about, like how to try to regain control? Is it really setting expectations or making a plan or it's hard to make a plan sometimes when, you're especially don't know the day of ovulation or day of retrieval and life is a little bit on hold.
Sure. So that, I mean, again, would kind of go back to meeting the patient where they're at. So if they're a patient who really is having trouble getting through the day because they just are feeling consumed by anxiety and they find themselves crying all the time, something I might implement for them would be either sort of setting a timer. So for 5 minutes, you can feel all those feelings. You can cry, you can be angry, you can let it wash over you. And after 5 minutes, for the next hour, you need to go do something else. Is it you have a call with a friend, you look at puppies on the internet, like whatever it is. And then when the hour goes off, okay, if you need to feel all those feelings again, timer 5 minutes. And so you kind of do that. And then the goal would be to go into longer periods of time that you can go without sort of feeling this and letting it consume you. Another trick for someone who may be feeling that kind of all consuming sort of 24/7 anxiety would be the trick of saying, well, okay, today is Tuesday and I already felt all these feelings and anxiety today. So I'm not going to feel them today. Wednesday I can feel them, but for the rest of Tuesday, I don't want to feel them. And sort of talking yourself through them to say like, okay, today I'm done. Tomorrow I can come back to these feelings, but for today I'm done and I want to enjoy the day. So there's all sorts of sort of like tricks and coping mechanisms for that. For some patients, it's really helpful to come up with, a more long-term plan, and by long-term, I usually mean week or 2 weeks, whatever. Like, okay, here are your goals for the week. I do a lot of goal setting with patients. Here are your goals for the week. And this is probably going to sound really basic, but sometimes for people, it's really helpful. You get up in the morning and make a list of what I'm going to do today, starting with I'm going to meditate. I'm going to eat breakfast. I'm going to have my coffee. I'm going to walk my dog. I'm going to, do XYZ for work. Like whatever your daily kind of life entails, then you check each box as you go. So you see, oh, wow, I've actually accomplished all of this. And so that's really helpful mentally too, to feel like, okay, as much as, my fertility life feels out of control, okay, I actually can control this. And I often help people figure out what things in their life they can control. And I think, a lot of times, for humans, when we're stuck in this cycle of anxiety, uncertainty, it's so hard to get out. And that's when sort of having a therapist or someone to speak to is really helpful, because I can come in and say, okay, hold up, you're spiraling and you actually do have control over a lot of things. So let me help you just sort of see it. So I think that would sort of be a long answer.
Yeah, no, I think that's great. A common question I guess I get asked from like a physician point of view that I also want to talk about, because I think it kind of does tie in with helping manage stress, is exercise.
Yeah.
I know you're like a huge like runner and a workout queen. People I find are like very scared to exercise. Like they think that that's going to make them not get pregnant. And actually exercise is really safe and like healthy for your body and for pregnancy. Of course, yes, if you're going through IVF and you're going through like a stimulation process where we're giving you medicines, your ovaries are getting very enlarged, we do for those short period of time tell you no exercise because of the risk of the ovary twisting. But for the most part, even like during like IUI cycles or doing transfers or other part of your life, exercise within safe limits, of course, is really good. And I find a lot of people, they are like, well, I'm scared to exercise, even if it's outside the window when we say those weeks we say not to, because they're worried they're going to lose the pregnancy or something bad is going to happen to the pregnancy. And then it's taking longer to get pregnant. And then people tell me, well, now I'm gaining weight and I don't feel attractive. And so now I feel like mentally, I just don't feel good about myself, or I don't feel like, as my partner may not be as attractive, which is all like probably mostly mental. And so that was like something I kind of wanted to point out is, yes, you probably shouldn't be exercising, like 3 hours a day, every day a week, something incredibly strenuous. There is something where if you exercise so much and you like exercise more than the calories you're taking in, your body sometimes can shut down. Your pituitary cannot release the hormones that kind of grow eggs as well. And so sometimes people can stop getting their period from extreme exercise. It's usually, really big athletes, but, really like an hour, 4 or 5 days a week for most people is, really healthy and safe. Besides, of course, the times when your physician tells you just to refrain from those time windows. I don't know if you get a lot of, I think you told me you get a lot of questions, like medical questions.
Yeah, I guess the first thing I would do is kind of bounce that back to you, because I get so many patients who come to me and say, I'm having a really hard time. I can't exercise. It's a big coping mechanism for me. And so I guess I would ask you to sort of, and then I always say, okay, well, we need to go back to your medical team. I always defer to the medical team for that, and have you sort of reiterate, okay, so it sounds like what you said. So an hour a day, 4 or 5 times a week, totally healthy when you're trying to conceive while you're pregnant. So I guess I would say, okay, so that's sort of what the guidelines you would say as a
Yeah, and of course there's some things like hot yoga, like extreme heat that we say to avoid during pregnancy, or extreme heat can kill off sperm around the time of, like insemination or your ovulation window. So there's always exceptions. So it's always good to ask your doctor if anyone's concerned. But I have so many people that are like, I'm just scared that I just stopped exercising completely, and because I didn't think I could, because I thought it was a reason I wasn't getting pregnant. And so
right.
I find that there's just a lot of fear around that.
Yeah. Well, I guess the second question I would sort of say to have you sort of share with everyone is to just kind of reiterate, because I do think there can be a lot of confusion among patients. So when you are stimming, okay, so when you're on the injections or right after a transfer, what are the exercise restrictions?
So usually we do say to take it a little bit easy for the first couple of days after an embryo transfer. Albeit, you don't need to be on bed rest. They've clearly studied that bed rest does not, for post-embryo transfer, bed rest does not increase pregnancy rates. I think all of us are a little bit of superstitious, not because we have good medical evidence supporting you probably could go out and exercise the next day, but I think we're all a little superstitious, and it's not well studied whether more strenuous exercise would lower implantation. So we usually say to just take it easy for those first couple of days, but then after that you can resume your normal activities. And you think about it, though, people get pregnant if they're going to spin classes and things all the time. So it probably doesn't affect that. And really the bigger thing is probably that the torsion from the ovaries being really enlarged from multiple eggs growing for the actual retrieval portion. I know we're starting to kind of run out of time, as we were going to kind of just open it to questions pretty soon. Did you have anything else you wanted to add, Rina, before we kind of...
Well, I feel like I had so many questions I wanted to ask you, and we took up all the time talking about me. So I guess to sort of just at least like conclude the sort of exercise component, because that is definitely something I see a lot in my practice, and I know you do too. Again, I think that does go back to, as you said, look, each person is individual. And so if you're a patient coming in who maybe has a prior history of eating disorder or overexercise, that's certainly a different case and something to manage. Which could be a whole other discussion about that. And I think that is something that people have a hard time sharing. I get a lot of patients saying they're, scared to share that with a physician. But I think, again, that is definitely, you're bringing in a totally different pathology to this. And that is something important to address and work through. For a patient who maybe doesn't have that history, but they're just like, look, I'm used to going to SoulCycle 5 days a week, and that's how I manage stress, what should I do? Again, as you said, most exercise that would continue to be safe. If you are going through a stim cycle or post-transfer, or maybe you're just feeling like, look, I don't want to have any regrets. I'm going to take that off the table. I do have a couple of great colleagues who specialize in fertility yoga. So they do know what is safe to do while you're stimming or after a transfer. And so often, I can give patients their information and send them to them if they kind of just want a safe way to move their bodies and do mindfulness stuff. So I have those resources that I'll refer people to, which people really love because then they feel like they're moving their body and getting that in, but they feel very safe about it. So, and I guess, yeah, there are so many questions. I would say maybe one question I can squeeze in for you before this, and then maybe we can do another one where I just ask you questions, would be something my patients come to me a lot and ask, and they're worried about is the medication side effects. What am I going to feel? Am I going to be tired at work? Am I going to be able to do my job? What are side effects? So if a patient comes to you and asks you about side effects from the medications, what would you say?
Okay, yeah, so it kind of depends on the medication. So for IUI cycles, like Clomid and Letrozole, the biggest side effects people usually feel is like hot flashes. People like wake up in the night feeling warm. It usually lasts mostly those first couple days when you're on the medication. It may get a little bloating, but it's not usually as significant as IVF. I tend to say that probably Letrozole and Clomid, people tend to have a little bit more mood fluctuations than actually IVF medicines, because how the medicine works is it kind of jumps your hormones up and down. That's how it kind of gives a little bit of a booster for ovulation. But most people tolerate it pretty well. IVF, the bloating, that is the number one thing people complain. You're like, if you think about it, our ovary normally on no medicines is really only growing and releasing one egg. So when we have multiple eggs growing on both sides, I like to think of it as, well, we have two things taking up more space. Your ovaries are physically larger. They're two things pushing in your belly. So everyone's like, my pants feel tight. I feel swollen. I have to put on my like yoga pants today. And it doesn't happen the first couple of days, but that is like universally, it's very rare for somebody to tell me they don't feel that feeling. And then they feel full because their ovaries are pushing on their bowel. Tired is actually really common with IVF medicine thing that people do tell me. And my assumption is maybe it's from the hormonal changes. We're growing multiple eggs. They make estrogen. So maybe that makes it sleep. It could be a combination of we're making you come in every other day practically at 7 or so in the morning. So it's an early morning. So that probably doesn't help the situation either. But a lot of people do tell me they feel pretty tired. Mood fluctuations, I actually don't hear many complaints about with IVF. And that's the thing people are most afraid. People say to me all the time, am I going to be crazy? Most people know, like, it's a very few people that I find do have those huge fluctuations. Almost always the people that do are often people who really get those fluctuations even not on medicine, so then it can be like a little bit more heightened, but it's really not something common. Most people tell me after like 3-4 days of the medicines it wasn't as scary as they thought it was going to be. I think it's really intimidating. It's not natural to think I'm going to like start injecting myself with medicines. I still, even as a medical provider, I think it's amazing that people are actually able to usually do this with very little trouble and problems. I'm like, okay, well, I have medical training, but somebody with no training is able to do it. And it's quite amazing because most people actually are able to handle it pretty well. Of course, some people have needle phobias, different things, and hire nurses to come help them for those reasons. But it's really the minority of patients that I find really struggle with that. It's not fun. I'm not going to say it's fun giving yourself injections, but I would say the bloating and tired really seem to be the main ones.
Yeah. And I think too, something I always remind people too is the anticipation is the worst. So, and I think you touched upon like I always say, look, if the anticipation and the before is the worst. If you've never done it before, you're seeing that your apartment now looks like a Dwayne Reed or a CVS, whatever, with all the medications. It's really scary. But once you start, I tell patients this and they all come back to me. No one has ever said I was wrong. It's a lot better than you thought because you're like, okay, whoa, I can do this. And the first one is always the hardest, for sure. I can say, for myself, I sat there for literally an hour, like staring at a needle before I did the first injection. And then it was like, okay, I got this. And also too, to remember that it's a finite period of time. So it's, 10 to 12 days, and then you're done. And, I always tell people too, like, to look one day at a time, as well. But I think, it's usually the anticipation is worse than the actual going through it.
Yeah. So I guess at this point we can just kind of answer up the questions because we're getting to the last kind of few minutes. So we had questions about acupuncture. So I feel like that's probably more for me. So unless you have any thoughts you want to add, well, you may have thoughts on acupuncture as far as stress management goes. From medical point of view, I think acupuncture is great. There are some studies that show it may have a benefit, and so it's really a hard thing to study, so we don't have as like clear cut data, but it's definitely not shown to be harmful, and it could be potentially beneficial. I have some patients who go and have loved it and are really have seen a difference. Other people have told me, it's just not for them, and that's, completely fine. I think if it's something somebody's interested in, it's something they like doing, I don't see any reason for them not to do it. And I do think if anything, maybe just like the fact that you lay there and it forces you kind of to relax, it seems to help people. I don't know if you have any thoughts on it with like stress or anxiety as far as that goes.
I would say the same. I always tell people sort of the same thing about the medical research and data. And then I say, someone said, what's the best time? So if you go to an acupuncturist, they're going to tell you, well, the best time is to do it for a long period of time. But I think more of the research says it's the 24 hours before a transfer, within the 24-hour window before and within the 24-hour after, is the best time to do it. So I always tell patients, look, if it's causing you more stress because maybe it's another financial burden, or you really don't like it, you hate needles and you get anxiety going, don't do it. If it's something that you feel like, okay, I'm, in my next cycle and I want to feel more in control, so I'm going to introduce it and I really love it. Okay, great. So I think that's sort of the answer I give. I think it's pretty individual. And I think, again, if you're someone who, if it's a financial stress or you, but you still really want to do it, the best time window is the 24 hours before the transfer, and then within the 24 hours after the transfer is sort of the optimal. But again, an acupuncturist is going to tell you, well, you really need to go more than that. And we have, great places we can refer you to also.
Yeah. There's some great places in the city that really focus on fertility acupuncture. And so one of the other questions was Valium before an embryo transfer. I would say majority of people actually don't need Valium. Most people, for patients who maybe have had one or people who haven't on this forum, it feels more like a pap smear, like in the sense that you put a speculum exam, you are going to feel a little cramping from that catheter going in, and then usually it's over within about 10 minutes. That being said, I definitely do give Valium for people who do have like high anxiety, or sometimes if someone's so anxious that they can't relax their muscles. Sometimes the Valium does have benefits because you do have to be able to sit there while an ultrasound is on your belly. So that's something I would say I would speak with your physician about, because I've had some people that it was just they really couldn't relax, and then I've given them Valium and their transfer went just smoothly and beautiful because it was just really needing to just relax and be calm for us to be able to just get things through smoothly. It's usually very few patients that I've had that actually need it. So I would say it's not majority, probably maybe 5%. But if it's something, or especially if someone's had a transfer before and it was, uncomfortable, or if you have trouble tolerating speculum exams, it's definitely something that can be considered. The one thing about Valium is you do have to have somebody to drive you home. It's not safe to be a little loopy and kind of just walk around the city and leave on your own. So that's the one thing, you do need transportation. And then as far as sessions with Rina, well, for our patients at RMA, you're available free. They're asking if you're covered by insurance, and so it's not something that they have to worry about. basically part of the RMA team, and we don't charge extra for your visits, which is, why I mean, it's a great resource that we have you.
Yeah, so if you're a patient of RMA, there's no fee to you. It's part of the wellness team. Myself, Dara, the nutritionist, is another great resource. So there's no bill to you. I guess I would sort of go back almost also to the Valium before transfer. Something I used to do with patients would set up for them would be if they were really nervous about a transfer or retrieval, would set up for them to do kind of a walkthrough of the ninth floor before, which is where the procedures happen, because it would just help them to see in advance, okay, this is what it looks like. Here are the people I might see. And we could kind of go through everything except for the actual operating rooms. So I'm wondering too, if now obviously that's not possible because of new regulations, but maybe we could even do a video. We could have someone at RMA, maybe marketing, do a video walkthrough of the ninth floor, say hi to the people that work there, and we could post it for our patients to see, so they'll know what to expect. They'll see where they change, they'll see the lockers, they'll see what the room looks like where they're waiting. They maybe see some familiar faces of people that work there, and that might be helpful too. I think
Yeah.
also, so maybe we could do that also. So thanks for the
yeah. Yeah, because so much of it is like the unknown of like, okay,
exactly.
where am I going? What am I doing? All of those things.
Yeah, and especially now that people are, unfortunately not, at least at the moment, not able to go with partners, so they know also what that looks like. And something I've been recommending to patients too, on sort of that vein, is who are really nervous about going alone, of course, is maybe bringing like a comfort object with them to leave in the locker, something from home, something from a partner, whatever, to just know, okay, this person's here with me. Maybe not physically, but bring something from home that you feel comfortable with. So I guess, are there any other questions or anything?
See if we get any. I think that seems to be it, unless we get one pop up. But I think we've almost reached the hour that we were supposed to talk, anyways, and we can always do another session sometime in the future if we, some patients, if you have questions, can always email either one of us, or DM the RMA Instagram or our Instagram or anything if you have anything specific. I think we were linked on it from this, and I just hope this was somewhat helpful for people.
Yeah, I hope this was helpful. And I had so many questions that I wanted to ask Dr. Thornton, so we'll definitely have to do another one where I can interview her, since we spent so much time talking about this. But I think there's so much, and thank you all for coming. I hope this was helpful, and you guys are all really strong and really amazing. I love our patients. I think, everyone, it's such an honor for me to get to work with all of you. So thanks so much.